She's booked out 3 months in advance, but we got her here today. Dr. Ramani is here to talk to us about how men and women each experience borderline personality disorder. Dr. Ramani, so many people think of borderline personality disorder as being a disorder for women.
Right.
And men can't have it. Why is that? First of all, that's not true.
It's not true
okay,
at
let's
all.
Get that
There's
straight.
no, other than very specific sexual disorders that are anatomically linked.
Prostate cancer.
Or even like vaginismus, like, when you're, like those kinds of things.
Yeah.
Other than that, there are just none of these mental illnesses discriminate on the basis of gender. Now, are there going to be different prevalence rates, and can those sometimes be hormonally driven? Yes. For example, women are more at risk for depression for various hormonal reasons. The onset of menstrual cycles, pregnancy, menopause. All of these are hormonal shift periods where women do become more vulnerable to depression. That's a biological reason. However, men get diagnosed with depression. Borderline personality disorder is so interesting, and this is where the personality disorders, they're so much more amorphous, and there's so much more
what
these.
is
By
that?
amorphous, they're like these, they're overarching, they're there every day. Depression comes and goes. Manic episodes come and go.
Right.
Sometimes even anxiety, like a phobia or a panic attack, will come and go. But a personality disorder is there 365 days a year,
That's right.
7 days a week.
Yeah.
It's there. It's just, it defines the person, right? So I think the struggle then becomes, because it's such a pattern versus a diagnosis, even those of us in the field struggle with, should we even be calling these diagnoses? Should we be viewing them as clinical patterns that are complicating treatment that we have to work with to help enhance treatment, like figure out how to work with these patterns? So that's an ongoing
That makes
conversation.
sense. I understand that, yeah.
So when we come to talk about gender, when we think even how borderline personality disorder is depicted in storybooks and in novels and in films, Fatal Attraction is a great example. Fatal Attraction is probably one of the most classic cinematic depictions of borderline personality disorder. Classically a woman. You are rarely going to see a man depict, if ever, I can't think of one, a man being depicted as having borderline personality disorder in a film. As a result, we are clinicians and we have our biases, and a person comes and sits in a room with us and they are a certain gender. So if we see a man in the room, it's almost like our borderline personality filter might drop a little bit.
And not only that, maybe a man who comes in the room and looks a certain way, or is a certain build, or has a certain voice about him, go, well, clearly it's not this.
Yeah, and we think it's not that.
Wow.
And this idea of even how men are socialized around emotion, they're often not socialized to have dysregulated emotion other than rage. Boys and men get
That's
socialized
okay.
for rage,
Yeah, right.
but they don't get socialized, or anger, but they don't get socialized for sadness or other kinds of emotions. So all of that combines both diagnostic bias, as well as sort of our preconceptions about men and women and how we see the expression of emotion, to sometimes result in us not seeing it in men. The problem is this: of course men can have borderline personality disorder, and because they're a man, it may not get diagnosed for a while. It may take a long time. They may get a delay in diagnosis, and because of a potential misdiagnosis, there'll also be a mistreatment opportunity. They may get treated for the wrong mental illness, if you will. They may get treated for bipolar disorder. They may get treated for an anger management issue or a sexual acting out disorder or something like that, versus focusing on, for example, the fears of abandonment, the dysregulated emotion, the instability, the impulsivity, and viewing it all together and being really great candidates for dialectical behavioral therapy.
So would you say that it is true that men are more likely to get a misdiagnosis?
Yeah, for sure.
Okay.
And I think, if anything, we likely misdiagnose men with borderline personality disorder as either narcissistic personality disorder or a disorder we call antisocial personality disorder. The armchair term on that is psychopathy. Those are the two places they're more likely to get pushed.
And those are already so hard to separate anyway.
Exactly.
That just adds
They
to it.
all are sort of, again, they're all hanging out in that same area of the DSM, but there are definite lines between them and different kinds of treatment approaches and outcomes.
And I want DSM, we use that term a lot, but explain what that is for
The
people.
DSM is the Diagnostic and Statistical Manual of Mental Disorders. It's a book put out by the American Psychiatric Association I ain't saying it's right, but it's what we use.
Well, yeah, that's
And
what we
so-
use. We
and
use
it's
it to
where-
diagnose mental disorder.
And it organizes, and not everyone agrees with them. In fact, the personality disorder section of that book is where the most criticism happens. And in the last several years, we've seen a lot of shifts, and now we don't focus just on lists of symptoms, but rather we look at patterns of intimacy and how people regulate their moods and how they regulate their relationships. We look at them in those more broad categories, which are more meaningful in personality disorders. Men and women relate differently. So that can also play a role in how we often miss borderline symptoms in men. But there are men out there who are terrified of abandonment. And so, and that coupled with many other kinds of patterns, personality patterns that are consistent with borderline personality, then of course a man can be diagnosed with this. I've seen it clinically, and like I said, if anything, they were diagnosed later in the game and were more confused by it and probably felt more shunned by the world for a longer time because it wasn't called the right thing.
Wow. Is your advice different to men or women to treat borderline personality
It's going to be
disorder?
no different for men and women. If anything, I would say for men, that the caution would be they're less likely to seek treatment out. We know men are much less likely to seek out mental health services than women, and when men finally do seek out mental health services, they tend to delay longer, so the symptoms are more severe when they finally present for treatment. So if anything, I'd say the treatments are similar, that for men though, to get into treatment as early as possible, as with anyone, to address any mental health problem as early as possible, to get those skills, to take them into as much of your life as you can.
And in case people only watch this video, I think what you said in another video was so profound. The diagnosis is only a tool to choose the right treatment method.
That's all it is.
It's not a label placed on you meaning, well, now you've been marked with the scarlet letter. It just means now we know what to do.
Right.
So don't be afraid to go and seek out that professional help to get that correct diagnosis so that you get the right treatment.
That's right.
Critical.
Yet people are still scared of that, and,
Yes.
and these labels can define people.
And they should not.
They should not. But to be realistic about it, when people have that fear, to me, MedCircle isn't just about educating people who are experiencing these symptoms. It's about educating everybody.
Yes.
If everybody out there could watch these videos and learn about these kinds of patterns, let's not even call them disorders, let's call them patterns. I do think that this is the kind of information that can help lift stigma so we can create more empathy. Listen, when somebody tells you they have a medical illness, such as cancer or diabetes, there's so much more empathy than if we're told they have depression or bipolar disorder or borderline personality disorder. Until we raise the level of empathy for mental illness to be at the same level as what we call physiological illness, my work isn't done, and nor should the work of any mental health practitioner. Until we iron that out, we are going to be fighting this battle in mental health.
You better preach now. I like it. I'm going to throw you a parade next week.
better.
Just for that.
Absolutely,
for that
because
little
it's
run you just
critical.
did, I'm going to throw you a
It's
parade
critical.
just for that. That
Thank
was
you.
wonderful. This is why we have you on. Thank you for
Thank you.
being here. Dr. Ramani, thanks for watching. Make sure you check out the other videos with Dr. Ramani on all things borderline personality disorder. Thanks for watching. Your next step is to head on over to MedCircle.com and sign up for the MedCircle Digest. What is it? Well, MedCircle will send you the latest articles and the latest videos on the mental health topics that matter most to you. So go to MedCircle.com, sign up for that digest, and let's keep this journey on better mental health moving forward.